In this video, we'll discuss adulthood through the perspective of biosocial development. And one thing that's important to keep in mind as we go through these topics and slides in this presentation is that most of the things that are mentioned in this video are broad generalizations determined through research, but they are not hard, fast rules that apply to all humans. They're just generalizations. So please keep that in mind as we progress. So definitely in adulthood, one will notice a gradual physical decline, and that's usually caused by genetic and environmental influences. It's just part of the aging process. Now, throughout aging, every organ, system, and cell slows down with age. And they mention a couple things here, like increased blood pressure or decreased breathing function. These are things just to keep in mind. And these are just natural manifestations of the aging process. Now, in the human brain, neurogenesis actually can occur throughout the entire lifespan, all the way through adulthood and even toward end of life phases. Now, if you remember, neurogenesis refers to the formation of new neurons, and especially in the brain structure called the hippocampus. And if you remember from former neuroscience type discussions we've had, the hippocampus is usually associated with the encoding of new memories, memory formation. Now, I'm going to have you stop here, pause the video. Please read through these, all these topics right here. And when you come back, we'll proceed to the next frame. Another factor that is apparent during the result of aging through the adulthood is changes in one's skin. So collagen decreases, and usually by ages 30, 40, the skin becomes a little less flexible, thinner, wrinkles, things like that, age spots. Now, these are not hard, fast rules. Please keep that in mind, that these are broad generalizations. Okay, in regard to the hair, it's common that the hair will start to change color, get thinner, grayer possibly. Body hair becomes less dense. They also refer to different things, like maybe middle age spread, a little bit of weight gain, body shape changes by age 50. And a lot of this, please keep in mind as I'm going over these generalizations, that a lot of these, there's a lot of variability in these topics. So these don't apply to every single evolving human. And is an important thing to keep in mind as you're looking at this frame right here, that at the very bottom, I mentioned that genes and exercise are very important factors in the variation in aging. Okay, then we're going to take a look at vision. And definitely vision does start to change. Peripheral vision narrows, nearsightedness increases gradually, beginning actually in your 20s. And so one thing you'll notice possibly as you're getting older, you may need to begin to wear glasses while you read, or even just reader glasses, even if they're not prescription. So that is just a common thing that happens with the eyes as one ages. And in hearing loss is a very natural occurrence. And it's usually after age 60 it starts to become apparent, but it may become apparent much earlier if one's been exposed to loud sounds, music, earphones, etc., etc. Now, sexual responsiveness does experience a little change. Arousal occurs more slowly with age. Orgasm takes longer. And, so feel free to stop the slide here, pause the video, and, look at this in a little more detail to gain further understanding. Okay. Now, for those who are seeking to become pregnant during the adult phase of development, one might experience like infertility. And that basically infertility means being unable to conceive after trying for at least a year. And so that can, be highly variable. Let's keep that in mind. And we're going to move on here. And here are some common causes of infertility. And so they say in males, things like advanced age, fevers, radiation, prescription drugs, stress, environmental toxins, drugs, alcohol, cigarette smoking, all those can reduce fertility. And in females, they can be affected by basically anything that impairs their physical functioning. For example, advanced age, disease, smoking, extreme dieting, obesity, pelvic inflammatory disease. So these are all common factors that cause infertility in males and females in the adult phase of development. Now here's just a couple of fertility treatments they mention. Feel free to pause the video, take a look at these, gain a little further insight into these. Okay, now we'll begin to take a look at the sexual reproductive system in middle age. And one thing that's common during this phase of development is what's called menopause. That's the time in middle age, usually around beginning around age 51, when a woman's menstrual periods cease completely and the production of estrogen, progesterone, and testosterone drops considerably. Now, an important thing to keep in mind about menopause here is it's more than just physical changes that occur. And actually, that can cause a lot of psychological consequences that are actually more variable than the physical ones. And in trying to treat things, that the changes that occur in the reproductive system in middle age, one might be interested in hormone replacement therapy. Please stop the video and look at all the details involving this treatment. Okay, so in male menopause, that's called Andropause, and that just basically refers to a significant drop in testosterone levels in men of that age. And it results in a reduction in sexual desire, erection, muscle mass, et cetera, et cetera. So sometimes, hormone replacement therapy, can be controversial, and as I say here, that more research is needed to test for to determine, the effectiveness of it and the safety of it. Now, what's important all throughout all phases of one's development is exercise. And that actually protects against serious illness, mental and physical. And it helps maintain flexibility and strength throughout one's lifespan. And one thing that they mention here is at the very bottom here is intensity is unnecessary. And regular exercise is. So basically, that means when one exercises, one doesn't have to be pushing it to the limit every time, and really forcing one's strength to increase, or extreme aerobics or something. What's more important is just basically a moderate amount of exercise, but being very consistent. So working out really often, but just moderately, and especially in adulthood, that's really important. Now, it's important to remember that overweight people are sometimes healthier than trim ones. So body fitness is what makes the difference. So that's just something to keep in mind, that actually, physical size or whatever isn't the determining factor in one's health. So please take a moment, review this slide. Okay, so another thing that can affect health substantially in this phase of development is the use of drugs, and both, legal and illegal, licit and illicit. So one thing they mention here is, the use of medication. And so here are some statistics if you'd like to review these for further insight. Moving on. Now, important thing to remember, definitely keep in mind, is tobacco use during any phase of our development is a leading risk for many diseases. The thing that to keep in mind here is, I definitely put like in the middle here that rates, they actually differ by nation, SES, gender, and cohort. So what's important about that is to know that definitely there are other factors that contribute to the effect, the environmental effect that these factors can have on one's health. Now here's something that's usually a little controversial, and some find to be very interesting, but small, moderate amounts of alcohol can actually be beneficial to one's health, especially things like red wine has been determined to be beneficial, as long as it's not done, in large quantities. So drinking in moderation usually is, no more than 2 drinks a day. Has shown to possibly, more often than not, increase life expectancy. So I'm always hesitant to read statistics like this because you remember that the environmental effects that alcohol can have on one, depending on one's genetic inheritance, can just produce different results. So definitely here are some other possible benefits of moderate alcohol use. And here is a list of a lot of the effects of alcohol use disorder and alcohol abuse. So please stop the video and take a look at each of these to gain further insight. Another important thing to consider throughout aging is the importance of diet. And that becomes, as one ages and proceeds throughout development, definitely quality of diet becomes increasingly more and more important. And because of the decrease of metabolism and less efficient digestion that occurs through the aging process, that actually having higher quality foods become more important. And a couple of factors that they mention here, to maintain one's weight, older adults, they must eat less and move more. And genetics can be strong factors that really influence the boundaries of normal weight. So they give a couple examples here, for different individuals, different populations. Now on this slide, they just give you some statistics regarding obesity and in the United States and worldwide. Feel free to stop the video and take a little look a little more in depth in this. And these are some of the consequences of obesity. They say, it's definitely not healthy. Mortality rate is lower, and excessive body fat, increases the risk of almost every chronic disease, including diabetes. And so they mention a couple of the effects that diabetes has on the body, to the eyes, to the heart, and possibly, to the feet. And then, of course, this is what's interesting, is there are also social stigma and psychological impacts that can be resultant from experiencing obesity. Depending on one thing that's important to keep in mind is that depends on the culture in which one belongs and grows up in. So they mention a few of the reasons why one might gain weight in adulthood, and take a look at these. So they talk about, having, trying to break habits, changing habits, that can be a very long, multi-step process that involves stage-specific strategies for each step. So sometimes in order to change a habit, such as, say, drug or alcohol use, or excessive sugar in one's diet, or lots of meat and very little vegetables, that kind of thing. In order to actually facilitate a long-lasting habit, a new habit, one may have to actually go through many phases. And they mention a few of the phases, like denial and awareness, planning, and then implementing with social support. So having support from your family or your loved ones while you're trying to make these changes over a long period of time is really important. And then maintaining the new habit as well. So constantly, maintaining the new habit. And if one feels like, one is kind of slipping, and you actually, go, say, take, for instance, go into a binge and eat a lot of cake one night or something, but, you're just trying, you bring yourself back to your new habit and just keep coming back to it and keep maintaining that until it actually becomes a long-lasting habit. And so I say, do these steps make sense to you? If so, why? And if not, why not? So something to consider. Now, definitely, this is a topic that is can be interesting and controversial, but health and income, how are they correlated? And so researchers have looked at this, and as every measure of health indicates, one's ethnicity, one's income, and place of residence actually are relevant factors in one's quality of one's health. Now, it might be worth stopping here and considering why you feel that might be the case, or why one would not agree with this. And for our final slide here, we're going to take a look. We're still looking at the correlations between health and income. Now, when I see income here, I actually use the term socioeconomic status, or we just call it SES for short. And you may see that a lot in a lot of research articles and things. So just be aware of that. But socioeconomic status, like money, education, they affect one's health very strongly. And the reasons why, they're saying they're giving possible reasons why, is education teaches healthy habits. And education leads to higher income, which allows better housing and medical care. That's really an important one because it's common that people who belong to or exist in a lower socioeconomic status, they actually cannot afford good medical care. They usually will have the least expensive insurance possible, and then because of that, the quality of the insurance is less, and then they are less likely to seek medical care because it'll end up costing them more money in the future because the insurance isn't covering it. Things like that. And finally, we mentioned that education may be a marker for intelligence, which is a protective factor. So that's a highly controversial statement. So I put here as a final question, so what are your thoughts regarding this? What are your thoughts regarding these issues? That might be something one might want to discuss in our discussion forums. Okay, so that concludes this chapter. So please complete your study guides for this chapter, and as well as the discussion forum as well. And thanks for your participation.